Hi, I'm Amanda. I'm a registered nurse and the education coordinator on the Mother-Baby unit at Logan Regional Hospital. Congratulations on the birth of your baby. I would like to go over a few important safety items in preparation for you to go home with your new baby. The items I'll be reviewing are on your discharge teaching sheet. Please look over all of the topics listed on this sheet and mark the topics you would like additional information on. Your nurse will review those items with you. Information on all of these topics is available in your Living and Learning Together packet. Birth control is an individual choice. However, we encourage you to give yourself time to return to optimal health before you become pregnant again. The World Health Organization recommends a minimum of 18 months between pregnancies. Prior to becoming pregnant again, we recommend you visit with your doctor to discuss and evaluate items like being a healthy weight, managing risk factors, and managing any illnesses you may have. Your pelvis needs rest for at least 6 weeks. This means you should not have intercourse, use tampons, or douche during this time. Fertility returns when ovulation begins. If you are bottle feeding or supplementing breastfeeding, you may ovulate and have a period in 6 to 8 weeks. If you are exclusively breastfeeding, it may be 2 to 6 months before you ovulate and have a period. Do not rely on breastfeeding as a form of birth control, and discuss birth control options with your doctor. You should contact your doctor if you are experiencing any signs of infection, including fever of 100.4 or higher, flu-like symptoms such as chills, body aches, fatigue, and headache. You should also contact your doctor if you have foul-smelling vaginal discharge, redness, swelling, separation, odor, or drainage at the site of your incision, episiotomy, or vaginal tear. Also, any increase in pain, tender, swollen, or reddened areas on your legs or breasts, difficulty urinating, or burning, painful, or frequent urination, postpartum depression that interferes with your daily activities, or having thoughts of wanting to harm yourself or your baby. Seek emergency care for vaginal bleeding that becomes bright red and heavy, soaking through more than 1 pad per hour, large blood clots the size of your fist or larger, leg, groin, or chest pain, or shortness of breath. Your baby will get a jaundice or bilirubin screening at the hospital. Jaundice is the yellow color in the skin and eyes. A little jaundice is common in newborns, and it peaks at 3 to 5 days after birth. Jaundice results when bilirubin builds up in the blood and deposits in the skin. Your nurse will show you your baby's bilirubin results on a graph and inform you of any follow-up testing that they will need to have done. If you notice your baby looks more yellow or the jaundice covers more of the body than when you were in the hospital, notify your baby's doctor. Most states require that all newborns be tested for certain metabolic and genetic disorders. The first test is done at the hospital. The second test is done within a few weeks of birth. You will only be notified if the test results are not normal. Take your baby's temperature only if you think he is ill. Take the temperature in the armpit. Once your baby is a little older, your pediatrician may want you to start checking the temperature by another method. If you don't know how to do this, ask your doctor to show you how. Normal readings are 97.9 to 99.5 degrees Fahrenheit. If your baby's temperature is higher or lower than normal, call your baby's doctor. Most experts agree that you shouldn't place a birth announcement in the newspaper or online, nor should you advertise that you had a baby by placing signs and decorations in your yard. Don't allow any medical personnel into your home unless an appointment was made beforehand and they have a valid ID they can show you. Limit social visits as well. Protect your baby from germs by insisting visitors wash their hands and staying home as much as possible for a few weeks. Always place your baby to sleep on their back on a firm sleep surface. a safety-approved infant crib mattress covered with a fitted sheet. Keep the area free and clear of anything that can cover their head while sleeping. No pillows, stuffed animals, heavy quilts, sleep positioners, or crib bumpers. Do not allow your infant to sleep in a car seat, swing, or other sitting devices. Sitting is not an optimal position for a newborn to sleep. Their head can fall forward and compromise their airway. Do not allow your infant to sleep on a sofa, armchair, or a bed with any adults or children. Avoid overheating your baby. Supervised awake tummy time is recommended daily to facilitate development. If you are breastfeeding, consider using a pacifier at night only once breastfeeding is well established during the first year of life. Have you watched the Period of Purple Crying DVD yet? If not, please do so. When someone shakes a baby, it's usually because tension and frustration build up when a baby is crying or irritable. Let's review the important action steps when a baby's crying becomes frustrating. First, carry, comfort, walk and talk with your baby. When your baby is crying, try all you can to comfort him. You will be able to stop the crying sometimes, but not always. Second, if it becomes too frustrating, it is okay to walk away. Put your baby in a safe place and take a few minutes to calm yourself. Then go back and check on the baby. Don't hesitate to call a friend or family member to come to watch the baby so you can go for a walk or just have a short break. Make a plan now. Who will you call? Third, never shake or hurt a baby. Why is shaking a baby so dangerous? Crying is the #1 reason parents shake and hurt their baby. Shaking a baby can cause blindness, seizures, learning disabilities, physical disabilities, and death. A baby's head is large in proportion to his body, so even just a small amount of shaking causes the brain to move in the head and can cause damage to the brain. Keep your baby in a rear-facing car seat as long as possible until they are 30 pounds and 2 years of age. Always read the child safety instructions and manufacturer's guidelines for your car seat and your vehicle. Fasten the harness snugly. Do not wrap the infant in blankets or extra clothing. If an extra blanket is needed, place it on top of the harnessed infant. Use the car seat for traveling only and avoid prolonged use of it. If the baby falls asleep in the car, when you get home, take him out of the car seat and put him in his crib. Watch your newborn closely while in the car seat to make sure his head does not flop forward and compromise his airway. 80% of car seats are installed incorrectly. The Bear River Health Department offers free car seat safety checks. Just call them for an appointment. You should contact your baby's doctor if he experiences any of the next symptoms we'll discuss. A list of these is also found in the Ready Reference Guide in your discharge packet. Jaundice that does not go away or spreads to cover more of the body. A rash that concerns you. Your baby is mottled and pale or develops cradle cap, and severe or persistent diaper rash. Watch for signs of cord or circumcision infection, persistent bleeding from the circumcision, unstable or abnormal temperature and thrush. Call your baby's doctor if his breathing is faster than 60 times a minute, if your baby is difficult to awake or is lethargic, or an overall change in activity or temperament, excessive irritability, poor eating, vomiting more than occasionally, or vomit that is green or bloody, sudden changes in bowel movements along with irritability, or poor feeding and diarrhea. A baby should have more than 4 wet and 4 poopy diapers in 24 hours by the 4th day of life if your baby is breastfed, or more than 4 wet and 1 poopy diaper in a 24-hour period by the 4th day of life if he is bottle fed. If your baby's temperature is greater than 100.4 degrees Fahrenheit, call his doctor. If your baby is dusky or has blue skin or lips, excessive sleepiness, floppiness, or difficulty waking up, poison or suspected poisoning, trouble breathing, or his chest is sinking in with breathing, call 911 immediately. Thank you for taking a few minutes to go over these important safety items.